Hello, my name is David and I'm a nurse. Welcome to Dying Matters Week. I want to talk very briefly about advanced care planning. If you're nearing the end of your life, it's really important that you take time, if you can, to talk to the important people around you about what's important to you at this time in your life. Think about telling them where it is that you want to end your life. Is that at home with the people you love around you? Is that have your dog or your cat next to you? Think about those things and talk to people. If you do one thing this week, try talking to those people who are important to you about what you want to happen at the end of your life. It's going to make such a difference. My experience as a nurse is that people feel lightened. They feel that they've been able to put affairs in order. And that's a good thing to do for everybody. Thank you.
Hi, my name's Julie Potts. I'm Palliative Care Lead for the Dying Service. Our service provides a range of care and support for families with children or young people with various nursing needs in the community. As part of our role, we provide care for children with life-limiting and life-threatening conditions. We have approximately 300 children on our caseload at any one time. As a service, we advocate for children to have emergency healthcare plans. These plans help to highlight what care is appropriate for the child in a medical emergency. This may be if they deteriorate suddenly or gradually. If you feel you know a child that could benefit from having a plan, if you contact their lead consultant, and the Dying Service will be happy to support that process. As it's Dying Matters Week, I think it's really important that we highlight that children also die, although it's very infrequently. The Dying Service provide care and support for families to enable them to stay at home at this difficult time. We work with the local hospitals, the local hospice and charitable organisations to provide care and support for the family at home, to help to keep the child comfortable and to enable the family to feel supported when they need us at such a difficult time.
Hello, my name is Dr Noel O'Kelly and I'm Clinical Lead for End of Life Care at Leicestershire Partnership Trust. I want to talk today about a difficult subject in this week where we consider that dying matters, and that is whether or not a patient and their family and clinicians decide whether resuscitation at the last minute of their life is appropriate or not. We need to work out if that is what the patient wants and the family wants, and we need to ensure that patients have a choice to make those sorts of decisions. So if the subject comes up, either from a patient, from a family member, a carer, or from the clinician, we should not be alarmed. We should recognise that we are only trying to ensure the patient gets the care that they need. Just by agreeing not to have resuscitation at that moment does not mean that you won't get the excellent care that you require for your end-of-life needs. That is still going to happen. So if it does come up, the question about whether you want resuscitation or not, and if the clinician asks whether or not you're happy to fill out a form called a DNA CPR, which stands for Do Not Attempt Cardiopulmonary Resuscitation, do not be alarmed. Please realise that we're only trying to give you the best care that you can have, but in the end, it is choice that you have to make in conjunction with your family and carers. Thank you.
Hi, my name is Rosie and I work for the Child and Family Support Service, known as CAFS, which is part of the Diana Service. Part of what we offer is pre- and post-bereavement support to children and their siblings, and also close family members such as cousins. So the pre-bereavement work is really important. It's memory-making activities, so we may do hand and footprints. The child can do lots of arts and crafts work, such as canvases, so they're really important for family memories. Post-bereavement support is, again, memory making. So the child will be given a memory box, such as this, and then we do lots of art activities So one idea is to use a sand art bottle, and the child uses different coloured layers of sand to represent each memory. The same thing, talking about memories, it's really important to acknowledge a child's not so happy memory, maybe a fight with their sibling, an argument, which can be represented by a rough stone. An everyday memory would be a nice shiny stone, and a special memory would be like a little gemstone. Books are also important. So some of the books we use which are really good is The Gentle Willow, that talks about how the animals in the forest try and make a tree better but they can't. Lifetimes is a good book for explaining to young children life and death. The Invisible String, Benny's Hat, and No Matter What, all very good books to use.